Welcome to Summerlin Hospital. The following video will provide you additional information regarding your upcoming procedure. In preparation for your upcoming procedure, you may be provided with chlorhexidine wipes. The location or body part of your procedure or surgery is what will determine if you will be required to use the wipes. These are very similar to baby wipes and are used to reduce the risk of infection. You will use these wipes the night before the procedure as well as the day of the procedure. Do not shave legs or armpits for 3 days prior to the procedure. You may shower the night before the procedure, the day of the procedure, or both. After showering, do not apply any deodorant, lotions, creams, or perfume. The night before the procedure, you should put clean sheets on your bed, and when going to sleep, use clean pajamas or sleeping clothes. The night before the procedure, after bathing, you will be using 6 cloths. The first wipe will be used to wipe the neck and both shoulders. The second wipe will be used to wipe both armpits, arms, and hands. The third wipe will be used to wipe the stomach and the groin area. The fourth wipe will be used to wipe the left leg and the left foot. The fifth one will be used to wipe the right leg and then the right foot. And finally, the last one will be used to wipe the back of the neck, the back, and the buttocks. Avoid the face and private area between your legs. Use all 6 wipes and dispose of each in the trash. Do not reuse the wipes. Stop using the wipes if your skin becomes irritated or reddened. If this occurs, please shower to remove the antibacterial agent from your skin. The morning of your procedure, repeat the previous instructions using the 6 new wipes. What to bring on the day of your procedure: picture ID, insurance card, cell phone and charger, eyeglasses. What not to bring to the hospital: money, jewelry, any valuables. If all possible, please leave any dentures or hearing aids at home. The following information will be provided by your physician's office. These instructions will not be provided by the pre-admissions testing department. What medications to take or not to take prior to your procedure, when to stop eating or drinking prior to your procedure, what time to report to the diagnostic and surgical center for your procedure. Thank you for choosing Summerlin Hospital for your healthcare needs.